Yes, I can see you.
Yes, sir, I
And
can hear you.
everything
Thank you very
is fine.
much.
The floor is yours.
Thank you very much, sir. Okay, honorable guests, ladies and gentlemen, dear colleagues, as you heard, I am the Deputy Director, Captain George Avaris from Hellenic Navy. I will brief you about the initiation progress and the latest updates of the COVID pandemic fight in Greece since the 26th of February. Are we ready with the presentation? I think that we should not see the notes.
Please start the presentation. We will manage this one.
Okay. So until the 13th of May, in Greece, there were reported 2,760 confirmed infections and 155 deaths due to COVID-19. 112,042 clinical samples were tested, corresponding to 10,750 per million population, of which the 3.7% were positive for the coronavirus. The first confirmed case was reported on the 26th of February in Thessaloniki, concerned a 38-year-old woman who had recently visited northern Italy. As an initial response, the Greek government moved quickly to cancel its year carnival events nationwide, and by March 10, schools, universities had cancelled all classes, followed by the closing of all cafes, restaurants, libraries, and museums around the nation on March 13. Within 3 weeks of the first documented case, all cultural and commercial enterprises were shut down, as were sports facilities and areas of religious worship. Cities or villages with gradually increasing numbers of COVID-19 cases were strictly quarantined. On March 13, the first death was reported. A 66-year-old man, member of a pilgrims group, who had recently traveled to Israel. Actions such as closing of all education and training facilities and institutes, lockdown and fully quarantine vulnerable big cities, towns, and villages have protected the national health system and somehow eliminated the number of deaths. Also, the tenacious effort concerning the tracing of each confirmed case lead as an outcome to the person-to-person infection rate to remain under 1, close to 0.5, according to the Greek National Health Organization. The correct communication of the information was also a vital element during the decision and implementation of initial actions by the Greek government. The limitation of fake news or conspiracy theories was achieved by a very well organized media campaign, followed by a detailed and briefed nationwide everyday broadcast conducted only by the head of civil protection and an infectious disease specialist. The public was well informed and thus persuaded to implement preventive measures, enduring not only social distancing and isolation, but also new financial hardships from an economy that came to a standstill. Greek authorities were quick to designate certain hospitals for the treating of COVID-19 patients. To ensure that they would remain isolated rather than treat them in all the hospitals across the nation wherever the victims lived. As an outcome, the healthcare system never reached its capacity, nor even came close to it. Only about a quarter of the initial available intensive care unit beds were used, and medical visits at all settings decreased substantially. The aim of the Greek National Health Organization remains to reach, in so terms, 12 beds per 100,000 citizens, which is the European Union's average. Currently, the respective number is about 1,020. From the financial perspective, and regardless the long-term period of economic depression, Greek government announced a package of measures to support the economy, businesses, and employees affected by the lockdown period. The measures include the suspension for 4 months of tax and social security obligations of corporations that were ordered to close by the state decree, with the sole condition that they do not dismiss any workers. This measure covers about 220,000 businesses and 600,000 employees. An €800 stipend also included, as well as a 4-month suspension of payment of taxes on employees of businesses, the activity of which was suspended, and on freelance professionals who work in sectors affected by the pandemic. In addition, a revision of the state budget, also announced by the Prime Minister, to allocate more than €10 billion in support of the economy. Since Greece based almost 30% of its total GDP on tourism, there are a lot of concerns and debates about what is going to happen in the next tourist season. It is believed that travelers, and hoped that travelers arriving from overland of neighbor countries may mitigate the consequences to tourism this season, as traditional markets remains closed due to restrictions. On the 4th of May, signaled the transition from quarantine phase 1 to loosen restrictions, and we enter a new stage from stay-home containment policy to stay safe. Phase 1 was the actually lockdown period imposed on 23rd of March, lasted 42 days, and the main goal was the control of the virus spread. According to the results, indeed, Greece succeeded to contain the spread of the infections, as on 3rd of May, the last day of phase 1, only 6 new confirmed COVID-19 cases and 1 new death were announced. Phase 2 has started on 4th of May by the gradually rollback of COVID-19 restrictions. The main goal of this phase is to gradually and safely restart the social economic activity. The plan consists of specific milestone dates and extends throughout May and June, and may be revised as it will be evaluated continuously against the COVID-19 infection rate. The use of a face mask is mandatory in all means of public transport, taxi, and health premises. Civil protection and healthcare is planning ahead and prepare all structures and build social resilience for a possible second wave of pandemic by studying all lessons learned from the previous period and, of course, other countries. The likelihood of a serious local disease spread still exists, especially in close structures, such as immigrants and Roma camps. Greek government applies isolating measures or relocating case by case in the camps where confirmed infection exists in order to tackle the further spread of the infection between immigrants or Roma and the relevant local communities. The overall situation up to this point is assessed as optimistic but still fragile. Thus, continuing vigilance and self-discipline is vital. It seems that the main key to success, in my opinion, in Greece were first, the fact that human life always remained the first priority, no matter how great the cost might be, and second, the well-informed citizens that believed in the measures taken and support them with self-discipline. Concluding, I would like to wish all countries to escape from the labyrinth of this pandemic by following carefully, as Ariadne's thread, the personal discipline rule as Greek mythology cites. We need calmness, focus on the final goal, individual responsibility and collective maturity in order to restart the global growth engine by flattering the COVID-19 infection curve. This concludes my short brief. Thank you for your attendance.
Thank you, George. Thank you for that informative briefing. We have one question to you from our spectators. What was your national authority most successful decision measure so far? Maybe more than one. And the second question is, if you could go back in time to the beginning of the crisis, what would you advise to be done differently? What about pre-crisis time? What could have we done to prepare better?
So, okay, sir, thank you. But if you please, can you repeat the first question? I only hear the second one.
The first question was, what was your national authority most successful decision measure so far? What is most successful you can estimate it, okay?
Okay, sir. As I already told in my closing points, I think that the most important decision that was taken by the government, it was the lockdown, because the political and the social cost is very big, and also the financial cost. But as I told you, human life comes first. So I think the most important decision was the lockdown, the early lockdown, and of course, social distancing. And the other one was the correct flow of the information. That was the two major elements of, let's say, the success in the Greece situation regarding COVID-19. So about the second question, if I could turn back time, I think that I would probably take even faster the lockdown measures, in my opinion.
Yes, thank you very much. Actually, it's interesting also for me because yesterday in Bulgaria we finished the emergency situation. And now the society is separated on to continue or not to continue, to blame the government that we have that emergency situation or not. And that is interesting. Do you think that, for example, in Greece, we know that even the harder measures than in Bulgaria, do you think that this should continue? And when should stop all these measures? When, for example, tourism, because in Bulgaria and Greece, both countries very struggled from this from the tourism. What do you think?
Yes, sir, I completely agree with you. Yes, that's the situation. Yeah.
Yeah, and here is now, because it's the summertime, we believe that this COVID-19, we hope so actually, we not believe, but we hope that this COVID-19, maybe the high temperature will be decrease the influence of this pandemic. But I would like to continue with the next presenter. Because the same questions we'll ask and Poland and Jordan and Bulgaria